Good morning, UCT students. My name is Dr. Sinclair and I'm a medical doctor with a special interest in psychiatry. I finished my medical degree at Stellenbosch University in 1998. Then I did my housemanship as well as my community service here at Tygerberg Hospital. And after that, I decided to move to London in the UK, where I there specialized in psychiatry. And there I worked until 2010 when I moved back to South Africa. So at that time, my psychiatric degree from the UK was not recognized in South Africa, and I needed a work where I could work flexible time because I had a very young family. And I approached University of Cape Town, Prof Stein, the psychiatry department, and asked them whether they maybe have something for me, anything stimulating, but where I would be able to work part-time. And they said that very little research in South Africa have been done on psychiatry and gambling disorders, and whether I would be interested in doing a MPhil in addictions and focusing on gambling disorders in South Africa. So at that time, I was a psychiatrist for 10 years, and I think I've never asked any patient about gambling, and I knew nothing about gambling disorders. And I said, well, okay, I can try. And then for the next 10 years, I worked on pathological gambling in South Africa, also worked as a clinician for the South African Gambling Foundation, and that's why I'm talking to you today about gambling disorders. So, my goals and objectives for you during this talk would be to, first for you, to be able to differentiate at the end of our talk between who is someone that can gamble, but gamble recreationally and as a form of leisure, as opposed to who is someone who gambles and has a gambling disorder. That's the one thing. Then the other thing would be for you to be able to understand the huge correlation between behavioral addiction, and the only recognized behavioral addiction in the DSM at the moment is gambling disorder, and then between chemical addiction, which is addiction towards legal as well as illegal chemical substances, like for instance alcohol, cocaine, heroin, and benzodiazepines. So for you to understand that there is a huge correlation between the addiction towards those two things. And then my last thing, which I would really think would be a huge goal for all of us, would be to decrease the stigma that's attached to gambling disorders. And this can be done by psychoeducation, and the impact that psychoeducation has on treatment-seeking behavior and the eventual outcome and prognosis of our patients is absolutely huge. So with removing the stigma that our patients, their family members, people that they work for and work with, and working on decreasing that stigma can have a huge positive effect, as we will see. Okay, so we all know that gambling is an activity that's encountered in almost all cultures throughout history. But for us, it's very important to distinguish between when is gambling disordered and when is it non-disordered. So it's easy to think of it in three ways. It's the one where you get social gambling, where gambling is done very seldom in isolation. It's done for very limited periods of time with acceptable losses, and the person also do not have unrealistic expectations. Then you get professional gambling, and professional gambling is also with very, very limited risks. And the very central to professional gambling is that the discipline is extremely central. And then you get disordered gambling. So with disordered gambling, it's very important that you all remember that the patient or the family members would complain that there's an impairment in the level of functioning of that person, and also there are distress that's being caused as a result, or that is as a result of the gambling. So how do we diagnose someone with a gambling disorder? So it first appeared in DSM-3 in 1980, and then it was under the impulse control disorder group. It was called pathological gambling. So it was with diseases like kleptomania, where you steal, trichotillomania, where you pull out your hair, and then pyromania, where you set fires. Then in 2013, it became part of the substance-related and addictive disorders in the DSM-5. And it's also very important because you will often hear that people will talk of gambling disorders as an OCD, which is wrong. And then you would want to think, but why is it wrong? And how can I explain to my patient that it's not correct? So it's very, very important to know that with OCD, the action is something that's non-pleasurable. Whereas with gambling, it starts with a very pleasurable activity. And therefore it is part of the first or the only behavioral addiction at the moment in the DSM-5. So clinically, a patient needs to meet 4 criteria out of 9 for 12 months. The criteria include a preoccupation with gambling. Unfortunately, most gamblers only seek help once they've really hit rock bottom, or they're about to lose their work, their family, or when they've lost all their money. And the reason why is because you need money to be able to gamble. And therefore, the majority of these patients continue to be able to work. Very few people know of their addiction. That's why it's often called a silent addiction. You cannot smell that they've been gambling. It's not like alcohol, or you can't see in their eyes that they've been gambling. It's not like heroin. And they do not have hangovers the next morning. They continue to go back to work. So it's a very silent addiction, and it's often completely left unnoticed. And the only thing that usually is a sign of the gambling is their bank statements, which majority of them, their spouses do not have access to, family members do not have access to. So yes, so the majority of patients only seek help once they've hit rock bottom. So gambling disorder is divided into 3 levels of severity. Mild means that they have 4 or 5 out of the 9 symptoms. Moderate means that they have 6 or 7 out of the 9 symptoms, and then severe means that they have all 9 symptoms. So one would ideally have all our patients come in and seek help when they have 4 when they meet 4 of the criteria, because treatment would obviously then be much easier, and also then they would have less losses. Okay, let's quickly look at the criteria for gambling disorders. The first one would be the preoccupation with gambling. So it would be that you would meet someone, and the majority of things that they talk about would be about gambling, about when they gamble, where they gamble, how much they've won. And that is very, very important, because gamblers only remember their winnings. They never remember what they've lost. So they will focus and almost convince you that they are extremely lucky and extremely good at what they're doing. Like for instance, here in Camps Bay, we had a patient who told me that he was the person that have won apparently the most unlimited payout machines in the Atlantic seaboard as far as word goes. But then if you think about it, he's probably also the person that have actually spent the most unlimited payout machines on the Atlantic seaboard as well. So with that preoccupation, they almost lose complete idea of how much they've lost. So they are preoccupied with gambling. All they can also think about is when they will go and gamble, how lucky they are today, how much they might win, how can they recover their losses. So they are constantly thinking of gambling. And then they develop a tolerance. So they develop a tolerance for the amount that they spend, and they also develop a tolerance for the time that they spend. So this exhilaration that they got previously from spending 500 Rand is slowly getting less and less and less. So they need to spend more and more and more and more to just get that extreme exhilaration and that same feeling. And then again, the same with time. They might start spending just about an hour at the casino, and then within a few weeks, they are there for 6 hours and they don't get that same kick out of it. So it's the same. It's almost like they are squirting out less dopamine at that time, like for instance at 2 hours, where they used to at 2 hours squirt out much more dopamine. And now it's just the same as with other addictions, where you develop a tolerance. You have to do more and more and more and more gambling, and you have to spend more and more and more time there, and you have to spend more and more money there to get that same high. And then they start chasing their losses. So they lose so much that they start to say, okay, I've now won, but I can't stop. I need to make up for what I've lost. So they start to the next day go back to win again, so that they can make up what they've lost. So like I said in the beginning, it starts with a very pleasurable activity, which is gambling. You can't say that something like OCD, for instance, hand washing, is never pleasurable. But you get a lot of dopamine squirts, while any normal person, or not normal, but any average person gambles. And then they just can't stop. So usually when you ask a patient, why are you here today, their overriding answer is always that they've lost control. Majority of them come in because they say that they've lost control. So they can't stop because those levels of dopamine in their brains need to continue to be fed. And they will continue to do gambling and continue to gamble even despite consequences. Little example, for instance, would be an elderly lady. We forget that older people also gamble and gamble a lot. Some of them develop severe gambling disorders. It often enables older people as a means to escape. So that's another criteria. Anyone a means of escaping. But an example of how someone was unable to stop and continue to do it despite putting her life at risk would be of this elderly lady. Her family banned her from Grand West Casino. She also lived in Cape Town. So her family made sure that she was not able to go into Grand West Casino because they recognized her. And even if she went in, she got in, if she did win something, then she would not be able to get her winnings. So this lady was banned from Grand West Casino. And at the age of about 75, 76, at night she would wake up and she would feel extremely lucky and think that she really needs to go and gamble now. And on her own, at night, she would get onto the N2 and drive all the way to Caledon because she went to gamble in Caledon where no one would recognize her and where she wasn't banned from. So it just shows that this elderly lady put her life at risk by driving at 3 o'clock or so in the morning all the way to Caledon, then lying to her family, they thinking that she's not been gambling. That's an example of where you are completely out of control. You cannot control your gambling at all anymore. Then the other way why people gamble is also because they gamble to escape. So many people use gambling as a coping mechanism. Often people would say, for instance, that they gambled just recreationally with friends, with normal, within normal time limits, with normal small amounts that they could afford, and not having unrealistic expectations. And then something happened to them, like for instance, their son was diagnosed with cancer. But now to go home and to face all the responsibilities of being a father at home, of that incredible diagnosis of leukemia of your child at home, he then just went to Grand West, started to gamble, and he just felt like he could dissociate, he could just relax, he could just forget about everything. And then gradually over time, a year, 2 years later, he realized that he's increased his gambling so much that he cannot afford it anymore. His wife is complaining about him not being there. Their son is still now in recovery, but now he's the one with a disorder, a disease. He triggered his gambling disorder. Then another example, another criteria is of course lying. People would lie about the severity of their gambling, and like I said, about the hours, the time, the money that they spent about it, their whereabouts. And often you will also hear that gamblers tell you that they are acting out of character. Like for instance, they would say, before I started gambling, I would not have done this. I would not have lied to my spouse about something like my whereabouts, but now I am because of the gambling. And also sometimes the lying is not as intentional. They often actually believe that they will do the good thing. Another example is a man that worked at a sports shop, but he was a manager, and he had access to the safe, and he knew that in the safe there was a lot of money for petty cash, something like that. So what he did was, on the Sunday when the shops closed, he left a little letter in the safe saying to his manager that I am taking this money, but it will be returned tomorrow morning. Him believing so strong in his belief that he is feeling lucky and that he will definitely win, that he actually left a letter saying that he had taken the money. So what he did was, he was a poker player. So he went to play poker that night. He lost all the money that he stole from his work. The next day he didn't go to work, but the letter was there saying that he had stolen the money. So then work comes, police comes, he's stolen the money, but he's lost everything. And he was so convinced that his lying in a way wasn't lying, it was, the stealing was almost as a result of the severity of his false belief about his gambling. Then another criteria is withdrawal. So that is where about 25% of individuals with gambling disorder experience insomnia, anxiety, agitation, and symptoms. Those are the three most important symptoms when they do not gamble. And then when they immediately go back to gambling again, those symptoms just go away, regardless of all the dire consequences still staying the same. They can sleep better again, they don't feel so anxious, their withdrawal symptoms go away. And then also another criteria is that people are bailed out by their family members. So this is often also where we tell family members to not, as we all call it, enable the patient. They will use all their money, for instance, on gambling, but then they will live with a parent, or they will ask for petrol money from family or from friends. So they will always be bailed out by family, friends, or loved ones. Then another thing, that's another criteria, is lost opportunities. So people will continue, they will lose their jobs, they will lose their families, they will get divorced, they will... another example, for instance, is a boy that got a bursary for UCT. He used to do spreadsheet betting, and then when he came to Cape Town, he started doing sports betting and internet betting. Internet betting is still illegal in South Africa, but he started doing internet gambling a lot at UCT, and eventually he used all his grant money, the grant that he received, before he could pay all his money towards UCT. In a way, also, his family was still thinking that he was still studying at UCT when he'd already left UCT. So there was a lot of lost opportunities for him, but he still kept justifying it in feeling that he makes more money through gambling, but he just couldn't see that if you showed it to him, he was almost like his brain was not seeing the real numbers there in front of him. Okay, so now that I've told you a little bit about the criteria for gambling disorders, I'd like to talk to you about gambling in South Africa. It's been illegal in South Africa to gamble until 1996. Before that, only horse racing was legal. So we do see a lot of older people who started gambling on horse racing with their fathers when they were young boys, because children were also allowed to go to the horse races. I think every Wednesday and every Saturday, something like that. But we saw a lot of gamblers that started gambling at the age of about 10 with their fathers, and now at the age of 64 they've gambled through the whole life. It's been part of their personality to gamble on horses, and sometimes some of them seek help really late in life. So until 1996 it was illegal to gamble in South Africa, but since then there's been 40 casinos, legal casinos. Then also we have illegal lotteries, limited, like I said, payout machines, then also still the horse racing, and then of course casino tables. Tables are something which men gravitate towards more, and slot machines are what women tend to gravitate to more, and men also like slot machines, but the one that people are most addicted to is slot machines because of the frequency in which they get rewarded. And then we have illegal forms of gambling in South Africa, which is FIFA and China, which we see a lot in the townships. And then, of course, internet gambling. And it's also still illegal for children to gamble. Anyone under the age of 18 is not allowed to gamble, but it's really prevalent in our schools, which we've also seen through a study here in South Africa. So now you will ask, but how many of the South Africans gamble? So in South Africa, about 48% of our total population gamble once a year, which seems very high, but then also lottery and those kind of things are also included in gambling. Then you would say, but where are we in regards to, where do we fall with the rest of the world? So Australia and the US, they gamble much more than South Africa. And then places like, for instance, Norway and Switzerland, they gamble much less than South Africa. So if you want to look at research, go and look at research on gambling in Australia as well as in the US. So in the US, I would really recommend you to look at research from Dr. Timothy Fong and Dr. John Grant. So in South Africa, very little research have been done on gambling, but like I said, we've done quite a lot of research through the South African Gambling Foundation, and which was also interesting, and which is very much the same as with the rest of the world. About 50% of our gamblers, I looked at 100 gamblers throughout South Africa, about 50% of those gamblers, those are now people with gambling disorders, also suffer from other psychiatric disorders. And that include things like, for instance, anxiety disorders, post-traumatic stress disorders, and depression, and other addictions. So in South Africa, it's very, very important for us to know that there is a free treatment for gambling disorders. So when gambling became legal in South Africa, it was also said that gambling needs to pay a type of money to this organization, the South African Responsible Gambling Organization, to treat people who has gambling disorders and to also help and prevent people from developing gambling disorders. So that is why I say there is free treatment in South Africa for gamblers, because the gamblers get 8 cognitive behavioral therapy sessions, 1-hour sessions each, individually, anywhere in South Africa. And it is done by clinical psychologists and social workers who were all trained by our addictions unit in Cape Town. So now, where am I now? So now, the other thing which I also mentioned to you was that when I was a psychiatrist, I never asked my patients about gambling disorders, because they already have so many other problems that you almost feel, why ask them about gambling if I don't know whether there's treatment or whether the treatment actually works. So when they asked gamblers, they asked them, have you ever been asked about your gambling? Only 1 out of 200 gamblers said that they have been asked about their gambling. So I'll also just look at another example, and this is really important. We had a man that we saw him after he was discharged from Tygerberg Hospital. The reason why he was admitted to Tygerberg Hospital was because he tried to commit suicide. He tried to hang himself next to the N1, and a Samaritan that drove past saved him, and he was immediately taken to Tygerberg Hospital. So at Tygerberg Hospital, none of the doctors there, that's not what the patient said, it might not be true, but he said no one asked him what, everyone assumed that he had depression. He did have depression because he had severe debt, but they didn't ask really deep into why the depression developed. And the actual reason was that he was unable to control his gambling, and he just could not see a way through everything because the gambling had such a hold on him. So when we treated his gambling as well as his depression, he completely recovered, and he is actually working today and leading a really successful life with his family. And that's just an example of how important it is for us to ask someone about their gambling, because there is treatment, people can recover, and they can have very meaningful lives even after they've hit rock bottom. Now, the other reason why people unfortunately do not seek help is because of the stigma attached to gambling disorders. And I think this is where it's so important that all these things that I've told you now, that you incorporate that, if you can, with discussions that you have with your patients, which is the part of the psychoeducation. And then often people think that there's not treatment in South Africa, or they think that medical aids wouldn't pay for it. So yes, like I said, there is free treatment, and I will give the number to you at the end of our session. Thank you. So your next question to us would be, what are the pathways into gambling disorders? So who would be more vulnerable to develop a gambling disorder. Then we can again think biopsychosocial. So it could be your biogenetic predisposition, your mother or father or uncle, aunt or sister or brother, they were or are already gambling addicts. So your genetic load is much higher for developing a gambling disorder. And then again, also with other addictions. So this is interesting because I often see that patients do not link gambling disorders with other addictions. So if you have a family member that has an alcohol addiction, then your risk is also much higher of developing a gambling addiction. So this is very important also when you talk to your patients that have gambling disorders. Tell them to tell their children that they must already from young age be very, very cautious about how they approach gambling and how much they gamble. Then the other factor is maladaptive coping mechanisms. And that's the example where I was talking about the gentleman whose son had leukemia, and where when he wasn't able to cope, he used the gambling as his coping mechanism, and unfortunately that then spilled over to become addiction. Then again, as I also mentioned when we did the research, was that 50% of people with gambling disorders have an underlying treatable mental illness. So once that illness is diagnosed, anxiety or for instance a depression, then one can actually also see how the gambling disorder becomes less and less and less. And then also, of course, access and social exposure. If you live with a family where gambling is seen as something which is very, very normal, and you start gambling from a very young age, and that's the example where, for instance, where people become addicted to horse racing. They start doing that very innocently from a very young age as something in which they bond with their father. Their father might have maybe had other better coping mechanisms. He might not have had the full genetic load that this person had. He might not have a specific trauma in his life. The father never became addicted to gambling, or to horse racing, but the son, he became addicted to horse racing simply because he had that constant exposure, and eventually he developed the addiction. So those are some of the most important reasons why some people are vulnerable and why some people develop gambling addictions. And now, towards the end of my chat with you, there's something which is also very important that you need to also know, and that's also to make sure that if someone does have something which looks like a gambling disorder, one must always first make sure that it's not someone that's maybe manic. Because if someone has bipolar and they become manic, they believe that they have so much money and they overspend, and many of them also start to gamble. So they are diagnosed with gambling disorder when they don't really have a gambling disorder. Then the other thing which we've also seen quite often were people that used to gamble, like I said, so do social gambling, and then they start to take anti-Parkinsonian medication. So with those dopaminergic medication, they then suddenly develop uncontrolled gambling and a gambling disorder. So this is also a gambling disorder that's not as a result of a learned behavior and so forth. It's as a result of medication. So then the neurologist really need to decrease the medication or start them on some other form of medication. This happens to few people, but it does happen, and we've seen it a few times already in South Africa. Then something else which I think which is also very important is we want to think now about treatment. So for us, the first step would be psychoeducation, in educating the patient, telling them exactly what is the difference between gambling disorders, what are the correlations between gambling and drug addiction or alcohol addiction, also tell these things to friends and family. Then also to start with motivational interviewing, seeing where would they like to be now, because we also believe that it's not only staying abstinent from gambling. Many patients want to continue to gamble, but they do want to do harm reduction. So there is still a very strong belief also in harm reduction and in decreasing the negative effects that the gambling has on people. Then also many patients exclude themselves. They fill in self-exclusion letters from casinos. This is not extremely effective, but it's another hurdle which the gambler has to overcome before he can start to go back to gambling again, and then which works absolutely fantastic. But it's very difficult for the patients is to make them have no access to money. So it's when the spouse or when a parent of the elderly of the child, or for instance a parent of the elderly gambler, when they take away all the gamblers' access to money, because then they cannot gamble, and then the treatment is much more effective. And then it's about cognitive behavioral therapy, where you very much focus on planning. You look at do imaginative exposure. But this is now something much more complicated. So maybe if you want to look into it, then I'll add some things for you to read about the treatment. But it's cognitive behavioral therapy, imaginative exposure, motivational interviewing, psychoeducation. And then what else? Yes, no medication has been proved yet to help, especially for the treatment of a gambling disorder. But like I said, 50% of people with gambling disorders, they have underlying other psychiatric disorders, which you can of course treat, and then that helps with the improvement in the gambling disorder. Okay, so now I've come to the end of my little chat with you, and I hope that you got out of this what you've been looking for. You're more than welcome to email me with any questions or any comments or anything. But I think the take-home message for you is also that a gambling disorder is a chronic disease, and it's treatable. And if left untreated, the results can be horrendous. They say that one gambler affects about 10 people around them adversely. And also the risk of suicide with gamblers are so much higher than with the general population. So always do a risk assessment on someone that gambles, but be full of hope for them and tell them that they can be treated. Thank you.